level, at the macro level, we can have intensified surveillance. You have to go and look for these patients, and so much information that they have that they can be able to volunteer themselves of coming today and letting you know that they have the monkeypox in these, primary care and secondary care setting, so that to ensure accurate case reporting, because there are 2 cases that has been mentioned now, but we don't know if there are more than 2.
APNU+AFC MP and Shadow Health Minister Dr. Cummings, during an interview with 90 News on Wednesday. Last week, Guyana confirmed its index monkeypox case in a 57-year-old man of Region 4, while on Tuesday, a second case in a woman in her 30s was reported. APNU+AFC MP and Shadow Health Minister Dr. Cummings believes that as a result of Guyana's minute population, contact tracing must be beefed up to avoid widespread infections. While worldwide the virus has been predominantly affecting the gay community, Health Minister Dr. Frank Anthony recently postulated that the monkeypox virus has nothing to do with a person's sexual orientation. While Dr. Cummings agrees that the virus will not be restricted to any population cohort, she's advocating for the provision of enhanced user-friendly health services and treatment for members of the LGBTQ+ community should they contract the monkeypox virus.
The treatment must be prioritized to gay, to bisexual and other men who have sex with men, because we've seen that has been the case, and of course try to avoid stigma and discrimination.
The Shadow Health Minister posited that at no point in time should persons from the LGBTQ community be deterred from accessing treatment because of stigma or discrimination. Dr. Cummings urged healthcare workers countrywide to practice the necessary precautionary measures, such as wearing their personal protective equipment, PPE, hand washing, and mask wearing.
Remember to wash their hands and make sure the environmental surfaces where they're dealing with, especially if they would have come in contact with patients, to ensure it's cleaned and regularly.
Additionally, Cummings believes that contact tracing and monitoring of persons traveling to and from the USA, UK, Europe, and Africa needs to be intensified, since the monkeypox virus is highly dominant in these regions.
You want to trace the contacts, those who they've come in contact with, different points. If it's a straight flight, or if you'll want to, to check. So you can't really ignore it, because it's real, and Guyana is a small population, and so we have to very well. That's how COVID started. That somebody came from the US, and came with a plane, and we just took it for granted. Right. And so I think we have learned from that experience and be a little more proactive.
This is Antonio Dey reporting for the AGP 90 News.